Hi, my name is Dr. Felicia. I'm a licensed psychologist, and today I'm going to be answering the question, why can't I just stop my OCD rituals? This is a question that I get from clients that I treat and also from family members of people who have OCD. And they wonder, well, if you have OCD and you're continuing in these rituals, why can't you just stop doing them? And clients oftentimes have the same question. Although when a client is asking themselves this question, they often feel worse, and it comes from kind of a self-judgmental perspective. And so I want to take some time today to answer these questions and help you understand exactly how the cycle of OCD works and why people who have OCD, or if you have OCD yourself, just stopping compulsions doesn't work. Now, the first reason that this approach doesn't work in approaching your OCD symptoms is because of the nature of OCD itself. The thoughts and the urges that people have when they have OCD are recurrent. They're also intrusive, and they also can cause a lot of distress. And as human beings, we don't like distress. And so what we're going to do is try and find ways to cope with this distress. And one way that that happens with OCD is through compulsions or rituals. And so the first reason is just the way OCD is. It's not a pleasant experience at all. It's very distressing. And people who are engaging in these rituals are doing the very best they can to manage the really uncomfortable and distressing symptoms that happen as a result of this disease. Another reason why just stopping rituals or cutting out compulsions doesn't work as part of OCD is because for people who have this disease, it is it's woven into their everyday lives. It's a habit, okay? So for a lot of people, they're doing these sorts of compulsions or rituals many times without even realizing it. And so this is another reason why it's very difficult to just cut it out, because before you are able to stop a behavior, you have to be aware of it. You have to be aware of when it occurs and what triggers it. And this is part of what happens within OCD treatment, is helping you understand, and when I say OCD treatment, I mean ERP for OCD, helping you understand what the triggers are for these rituals. And so part of cutting out these compulsions and addressing the symptoms is understanding what triggers them in the first place. The third reason why this can be really difficult for people is they may have tried once to get rid of compulsions and found that it was very difficult and very distressing. And so if we think of an example of perhaps somebody who has issues with contamination, and they're in a situation where maybe they forgot their hand sanitizer or they just ran out, they're in a situation where they're now forced to not engage in compulsions. But what ends up happening is that that experience can cause a lot of distress, and the distress can cause someone to use other sorts of ways to cope with it. And so that person may not be able to wash their hands or get them clean, but in their mind, they may be trying to calm themselves, soothe themselves, imagining things that are clean, whatever they do, and whatever one would understandably do in a situation that's causing them a lot of distress. And so the point is, even though somebody may either try to put themselves in a situation where they can't do compulsions, or they are put there inadvertently, it causes so much distress that they're not going to try and do that again. And it makes sense, because you don't want to just cut out compulsions unless you're doing it in a supervised setting with a professional who knows what they're doing through ERP. Another reason is that when people stop doing compulsions or try to stop doing compulsions, they don't have any suitable or helpful ways to help them deal with that anxiety and distress. And if we understand the way OCD works and the way, just general emotions work, they are not going to last at the same intensity, or they're not going to last at the same intensity forever. So if your anxiety, let's say, is at a level 10 right now, it is not going to stay at a level 10 usually for 5 hours straight. Feelings wax and wane, they change in the intensity and how we experience them. However, when people are caught in this OCD cycle, they're never in a situation, or rarely ever in a situation long enough where they can see that, wow, even though anxiety feels horrible, it's not going to destroy me. And so they're caught in this cycle of kind of short-circuiting the anxiety before it has a chance to level out or resolve itself on its own. And so for people who are in these situations, they haven't learned any adaptive ways of coping with the anxiety that accompanies OCD, or not even just anxiety, but other sorts of challenging emotions, because they haven't learned any substitutes. They think that the compulsions and the rituals are the only way that they can cope with it. When you take on treatment, when you take on OCD through ERP treatment, you will learn that there are substitutes and there are things that you can do instead of your compulsions. And so when you learn that, and when you learn that as distressing as anxiety, shame, disgust, and other sorts of emotions are, they're not going to destroy you, then you can learn that it is helpful to not continue in those cycles, those OCD rituals and compulsions. And this is a key part of your success. That's what you learn through ERP. And so it's really important that if you have OCD symptoms, that you don't delay in getting treatment for OCD. They found that the time for on average for people to get the right type of treatment for OCD is about 17 years, which is a really long time. So if you are having OCD symptoms, please get help as soon as possible. If you have OCD and you want to book a free consultation with me, go ahead and click the link in the description box of my website so you can book a free consultation. So I hope this helps. I'm going to go over the main points I talked about again. So, the question of this video, why can't I just stop doing my OCD rituals? The first one is the nature of OCD itself. OCD is a distressing disorder. It causes a lot of distress and debilitation. And naturally, as a human being, you're going to try and do your very best to circumvent that distress. Okay, so that's the first one, the nature of OCD itself. The second one is that a lot of these OCD rituals are just part of a habit after some time. People don't realize that they're doing it because it's just become an automatic part of their lives. And in order for these cycles to be discontinued, we have to understand what triggers it and what we're doing that is not helping, so we can figure out the right types of coping mechanisms to help us through. And then the third reason that I talked about is that you may have tried to either by choice or by force. When I say by force, meaning a situation you had no control over. And usually for people, when that occurs, it's very distressing. They haven't learned helpful coping techniques. So they're like, I'm not going to do this again. I'm going to make sure that I'm in a situation where I always have my rituals on hand and ready to perform. And treatment teaches you that that is not necessarily the case. You don't need to always have those rituals. You don't need to have them at all to be able to cope with distressing emotions, okay? And then the last point that I talked about is just not having any substitutes, any learned helpful ways to cope with intrusive thoughts, images, and urges that are not compulsions. And so through ERP, that is what you learn. You learn that these very distressing emotions are not going to destroy you, but you can cope with them. So again, if you'd like to get ERP, you'd like a free consultation, go ahead and book on my website by clicking on the link below. And I hope you have a wonderful and peaceful day. Please let me know what other types of videos or other types of topics that you would like to see in the comment section, and enjoy the rest of your day. Bye-bye.